nurses here. Is that all right if I watch you administer your medications?
Absolutely. Sure.
Before we do that, could you give me an S-bar on your patient?
Yeah, that's fine.
Okay.
So in room 620, we have Ryder K. He has no known allergies, and his doctor's name is K. Phillips. He is a full code, and his primary diagnosis is a stage 2 diabetic ulcer. He was admitted to the floor complaining of increased blood glucose levels. That's happened over the past 5 days. It's been up in the 300s, which is abnormal for him, he's stating. He also has a non-healing wound on his right heel that appears to be, it's been around for about 3 weeks and doesn't want to heal at all. His additional diagnosis is that he's a type 1 diabetic. About 20 years ago is when he was diagnosed, and he's been insulin dependent since then. And then until about 3 weeks ago, his blood glucose levels were where they should be, in the 120s. But then recently his A1C had been revealed to be normal. It was 5.2%. So it being in the 300s now, since admission, is kind of abnormal. So his pain was at a 6 upon admission. It was on his heel from the ulcer. And it's back down to a 1 now because he's on morphine. He is awake and alert ×3. He's admitted to tingling in his bilateral lower extremities. He doesn't seem to be in any kind of stress. And his speech is clear. He has good posture and steady gait. He's Perla. He denies any coughing, wheezing, dyspnea, or chest tightness. His lung sounds are clear to auscultation in all lobes, and his breathing appears unlabored. His S1 and S2 sounds are present, and there are no presence of any kind of murmurs or galloping or rubbing or anything like that. There was no edema noted. His abdomen is flat and symmetrical and non-tender and soft. His bowel sounds are present in all 4 quadrants. He has no ascites, no feeding tube. He has been put on the 1800 kcal diet with a 2-gram sodium restriction, and he's wanting more information on that because he's had trouble adhering to it. It appears he is self-voiding, and his vitals are normal. He's on a couple of different medications. We have Simvastatin, gabapentin, NPH and regular insulin, and then morphine sulfate. And we're actually going to be giving him his regular insulin. And he has a right median forearm IV right now. Most of his labs are pretty normal. Yeah, his doctor does want a dressing change later, and then we're currently waiting on a urinalysis. So, and it looks like his blood sugar is in the 290, so we are going to be administering insulin. Okay. That's what it says in the mark. So.
Okay, great. Can I ask you a couple specific questions?
Yes.
Sure. Okay, the first one. Why specifically is this client receiving this medication?
He's a type 1 diabetic, and his pancreas is no longer creating its own insulin, so he's needing insulin from an outside source.
Okay. And what action does the medication have on the body?
Well, when it comes to insulin, insulin increases the uptake of glucose in the skeletal muscle and fat, so it keeps his body from trying to find energy from other sources, like breaking down fat or protein, which can make his body acidic.
Okay. And when should you question administering the medication?
If his blood glucose levels are abnormal, I would question giving the medication. Like if it's too low, I wouldn't give it to him at all. And if it's too high, I probably have to call the doctor before giving anything.
Okay. Does this medication have a therapeutic serum level?
It actually kind of does. I mean, the goal is to get his blood glucose levels to a certain point between like 70 and 120, so that's about the therapeutic serum level.
Okay. And what vital signs must be monitored?
Well, I mean, you want to watch the vital signs that might be related to hypoglycemia. So, I mean, this isn't a vital sign, but you want to watch their level of consciousness and see if they're confused or if they're fatigued or dizzy or sweating or anything like that. And then also, if their heart rate increases, that's a sign of hypoglycemia also. So, I guess that is a vital sign. Heart rate.
And which physiological parameters should be monitored when the medication is being administered?
Well, level of consciousness, and then heart rate, things that might indicate that something is wrong. So.
And what interventions must be taught to the client to ensure that the medication is administered safely in the hospital?
You probably want to teach them about how the medication works, what specific things to watch for. I guess for them, in their case, they want to make sure that the nurse is not injecting into the same site over and over again, because you don't want that to get, I guess, fatty deposits in that area. That hurts. You probably also want to make sure that they understand the different medications they're supposed to be receiving, like their insulin, get ideas of like how many units are associated with how high the blood glucose levels is, have them like know the different signs and symptoms of hypoglycemia, so if they're having those happen or if they're feeling those, they can notify us ASAP.
And what interventions must be taught for taking the medication safely at home?
Well, rotating sites, like I had mentioned, you want to teach them to use new items. So don't reuse needles, don't share needles with people. Make sure that they know, again, the signs and symptoms of hypoglycemia so that they know to get help if they feel like they're not able to control their blood glucose levels. You probably want to teach them signs and symptoms of anaphylaxis the first time you give them the drug. And I think that's about it.
Okay. And what are some side effects and potential adverse reactions of the medication?
Well, anaphylaxis being the big one, and then also you want to watch for hypoglycemia because that is in fact a side effect of the medication, which is a little complicated, but as long as they know the signs and symptoms.
Okay. And how will you know the medication is effective?
If it lowers their blood glucose levels to the therapeutic range. So I will probably come back in and check on them in about 15 minutes to make sure that they're okay.
Okay, great. That's all the questions I have for right now.
Okay, so shall we go in and see the patient?
Sure.
Gonna knock. Hello, Mr. K.
Hi.
Or Ryder K. I'm actually here to give you your insulin today. Did you order any food yet?
Yes, I did. It should be coming here in about 15 minutes.
Okay, and that's good because the onset is about within that time range. Okay. Alright, I'm going to go ahead and wash my hands and hopefully not knock the table over. Okay. So, according to your doctor, you get regular insulin. Is that right? Okay. Well, why don't I go ahead and just make sure that this is the right patient. Can I get your name and your age, please?
Ryder K, 67 years old.
Ryder K, 67. Okay, I'm going to check over here and make sure that that's the right person. Yeah, that seems like it does match up with the MAR. Okay. So I have regular insulin here. No, I don't have any allergies. Okay, it doesn't seem like it's expired, and it seems like it's clear. There's nothing inside of it. So check in the MAR. Also says regular insulin on there. I'm just checking to see how many units that you're supposed to have.
I do it myself.
Okay, well while I do that, why don't I also just ask, do you have any allergies I should know about?
I don't have any allergies.
No allergies?
No.
Okay. And that matches up with what I'm seeing in the MAR, so it seems like you have no allergies. You'll have to forgive me for taking a moment. I just need to make sure I get the right information.
It's okay. Take your time.
All right, thank you so much. I appreciate that. Okay, and also I see in your chart that you wanted to some help with your diet. Yes, I've not been keeping up with my diet for some time now. How would you like that information? Would you like me to help you with the website, or would you like some reading material? Just give me something to read. I think that is better. Okay, so I'm going to, when we're done here, I'm going to the mental room and find some information for you, print it out and then read it. Okay? Thank you. Okay, no problem.
Okay, so we said that your blood glucose was about 290, right?
Uh-huh.
This means you get 16 units of insulin regular.
Okay.
Okay. That helps. It evaded me there for a while. Okay, got regular insulin. It says regular insulin here, and it says you're supposed to get it subcutaneously. And it also says that for you, it is due at 1,700 hours, and right now, you're just short of that, so we're right within the right time. And then you already gave me your name and your date of birth. Do you want to give it to me one more time?
Ryder K, age 67.
And that's what I'm seeing in MR. Alright, so we got right name, right dose, right time, and the right medication. Okay, I'm going to go ahead and start pulling it up. I already washed my hands. There we go. I'm going to swab the top. Actually, you know, while I'm doing this, why don't I just ask really fast, do you know the different side effects of the medication and how it works?
No, not really.
Okay, well, the medicine works by making it so that your body can receive energy from glucose by bringing it into the cells, but you can't do that without insulin. I'm going to put this down while I talk. So, insulin helps to bring it in so that your body can have energy, and otherwise you wouldn't have any energy and you would go hypoglycemic, which is not fun, so.
Okay.
And then a couple of side effects, or possible side effects that you probably should be aware of is hypoglycemia, and that can be really not fun. So we're trying to avoid that by giving you insulin. And essentially the things that I want you to watch for is if you're feeling like you're confused or you're dizzy or you're sweating and you just don't have energy, hit your call light immediately, okay?
Okay.
Alright, so can you remember if you change level of consciousness, or if you feel like you're not right in your head, or if you're feeling fatigued or dizzy? You remember those, I guess?
Yeah, I remember it.
Okay, I've swabbed the top. Okay, and you're supposed to get 16 units, which is what it says here, of regular insulin. You know what? Hold that thought. Okay, so I'm going to just really fast get another needle. I'm going to get another needle. Which I'm opening for the first time. And then, of course, re-swab the vial. But first, I'm going to draw up 16. Units of air. I'm going to put that into the vial so that I can pull out 16 units of regular insulin. Okay, you tell me if you think that looks like 16? Yep, 16. Okay. Don't work right. This here. I'm going to try to recap it. Hopefully it doesn't roll away from me this time. Why you gotta be like that? Stop it. Every once in a while you get these caps that just, they're not going to cooperate. You just have to fight with it until you get it right. There we go. Okay, I'm going gonna check one more time. So your name is,
Ryder K.
and you're how old?
67.
Okay.
That's what it says here in the MAR.
And then we said regular insulin. It says regular insulin. I'm gonna check again tomorrow. Regular insulin. It's supposed to be gotten subcutaneously. Do you have a preference on where you get your insulin?
On my abdomen is fine.
Okay. I'm gonna go ahead and do your right side. No, your left side actually, because that's closer to me. Did you have that recently? Or the last time you got your insulin, is that where you got it?
Yeah. On the like, they just rotate it.
Okay. Alright. You said your name was Ryder K?
Yes.
Okay.
Ryder K. 67 years old.
Alright. Which that's what it says on your name band.
That's fine. Okay. He'll just give you a little.
I'm gonna swab the top. I'm gonna check one more time. Yep, your name band matches what is said in the MAR, and that's also what you said your name and your age was. Okay. So the fun part is I don't have a scanner, so I'm actually going to have to type in the medication.
Okay, that's fine.
Okay.
Do you want me to read it off for you?
That would be phenomenal.
Let me know when you're ready.
You could do either one first. Just let me know which.
Okay, I'll do patient ID first.
Okay.
So we have 686
686
76
76
45
45
607.
07. Yep. Your name popped right up. Okay.
For me to read that off to you too.
Sure.
D 9
Yep.
C
C
9 C 8 7 B 9
9
E
E
0
No, I think it's a 0. That sounds right to me.
B
E
A
A
4
4. Okay, we have a green light on that. So I have. I already touched my laptop just now. I'm gonna reglove really fast. She's probably gonna have to rewash my hands too. This has been one of those days. And the trash can used to be here. It's over here because it's gonna just elude me every single time. Okay, so we have right name. I have the right route, so we know it's gonna go subcutaneously in your abdomen. I have the right medication. We know it's supposed to be regular insulin. I have the right dose because we know your blood sugar is 290. So you're supposed to get 16 units. It's leaving a weird residue on my hand. Okay, and then really fast, can I verify one more time that you don't, or did you say that you don't have any allergies?
I don't have any allergies.
Okay. Which is also what it's saying here. There we go. Every time you rewash your hands and try to put gloves on, it doesn't want to work. Okay. Alright, this is going to pinch a little, just a heads up. Although, maybe I'm going to go ahead and swab it one more time because it's been sitting there a while. Just to make sure that we don't pass infection or anything like that. Okay, just wait a few seconds while I check one more time. Okay. Everything seems to add up, so yeah, just gotta pinch a little. Okay, pretend I'm not actually going to inject it because this is not one of the injectable pads. I'm gonna pull it right out. I'm not gonna recap it. I'm gonna stick it in the sharps container. Okay, can you tell me back the side effects that I had mentioned earlier?
I would, hypoglycemia would be cold sweats, dizziness, some change in level of consciousness. That's what you said?
Mm-hmm.
Okay.
Okay. And then I actually have a little packet with more information about type 1 diabetes and the things that you need to watch for. So I'm going to go ahead and give you that. And then you had mentioned showing an interest in learning more about your diet. Is that right? Because I had heard you were having issues adhering to it.
Mm-hmm.
Okay. I can have a dietitian come in and talk to you more about that if you would like.
Okay, sounds good.
Okay, here's the packet I was talking about. And then I'm going to go ahead and document while I'm in here. I'm going to put my initials on here with the date and the time and then the place, which is your lower left quadrant, along with your blood glucose levels in the comments. And I'm also going to do the site at the electronic health record, not just the MAR. And I have to sit and think for a moment to make sure I'm not forgetting anything, because I don't like to forget things. I did put it in the Sharps container, right? I think so.
Yep.
This is the Sharps container, right? Okay. I'm just making sure you know it is. Thank you. Okay. Well, I think we're just about good. Do you have any questions or anything before I head out of the room?
No. I have my paper, right?
Okay, yes. Okay. And this will tell you all about hypoglycemia. I'm pretty sure there's even some information about anaphylaxis if you feel like you're experiencing that, okay?
Okay, thank you.
All right. And you have your call light.
Alright.
Okay.
Hi. Okay. I have just a couple more questions for you. Were there any pertinent pieces of information that you reviewed before administering the client the medication?
I had to check his blood glucose levels to make sure that he was in need of the insulin, because if they had been too low, I wouldn't have given it.
Okay. And did this information affect your decision to administer the medication?
Absolutely, because I would have withheld the medication if the blood glucose levels were too high or too low. And if they're too high, I actually have to call the doctor, so.
Okay. And the information also affected how you administered the medication?
Say it again, sorry?
Did the information that you obtained affect how you administered the medication?
Well, yeah, I would have withheld it if it had been too low or too high, essentially. Or if the patient appeared like they had an altered sense of, like, mental status or anything like that, I wouldn't have administered it.
Okay. All right. That's all the questions I have.
Okay, and then, of course, I'm going to dump all of this out before I continue on, so.
Okay. Thank you so much.
Mm-hmm.